welcome to Around the Best Town. I'm your host, Woodbridge Mayor John McCormick. Today we're joined by Ron Simoncini, who's an Executive Vice President with Jones Lang LaSalle. We're joined by Kevin Martinez, who is a Portfolio Growth Manager with Hackensack Meridian Health. And of course, you all know this young lady to my left, Carolyn Ehrlich, who this normally would be a Greenable Woodbridge show, but we're combining it with Around the Best Town, and we're kind of co-hosting it.
Yes.
So why we're here tonight is to talk about Hackensack Meridian Health. That's one of the biggest things to ever happen to Woodbridge Township in our history, which is Hackensack taking over 250,000 square feet in a brand new building in the Metro Park office complex, the train station complex, and it's huge for this township. It includes almost 200,000 square feet of office and actually 60,000 plus of a medical center, which I'm going to let people explain. But it is phenomenal for this township because it's the corporate headquarters for Hackensack Meridian Health, which is the largest healthcare provider in the state of New Jersey. So let me start with Ron, as the guy who, the realtor, kind of put this whole thing together. Tell me about the project.
So it's a big team at JLL, and while I was part of this thing since the beginning, I want to give credit to those guys. The genesis of this is in the Murphy administration, excuse me, wanting to repurpose its train stations, wanting to activate the train stations, new uses, insightful kind of redevelopment programs, and they made Metro Park Station available. And three developers came together and formed a team, and they submitted a vision for it. And it was the winning vision. And a few months later, working with Hackensack Meridian, it was clear that they wanted to move their headquarters office someplace that had sort of transit village values to it, and this was waiting for us. And so a lot of pieces to it. You have to figure out the financing, which incorporated the Aspire grant program. Obviously, the municipality has an interest in the site. NJ Transit has an interest in the site. And so blending all those things together and coming up with the right mix took about a year. And here we are, ready to open maybe in January.
And this is a spirited competition. There were four serious bidders. I know Carol represented the town, not with a vote on the committee, but with input. So did Marta Levsky, our planning director, and that was an exciting process.
It was great to read all of the bids and to listen to all the reports. So when we went through it and we sat through it, we didn't know we weren't going to get a vote, but we would have voted for you.
Oh yeah. So JLL is a friend to all the developers who participated. My team was with the Door team, Denalo, Onyx, and Russo.
Right.
And they've each got different experience actually in the township already. And we obviously felt very comfortable with the environment here, and you guys have been terrific people at envisioning the right things for the municipality and giving people a chance to bring their ideas to the table. And that, I think, was the hallmark of this thing, was a lot of collaboration from the very beginning.
Did your firm represent other developers with different people?
I don't think that we had any brokers on this because in the contest between the developers to get the job, there wasn't really a brokerage role there.
Okay.
But all the developers who participated are in some way affiliated with JLL.
And I got to tell you that my position of this whole thing was I didn't love it in the beginning because it does include a residential component, but I was afraid of it being an apartment complex with an office building, and now it's an office building with a small apartment complex, and the office building is run by Hackensack Meridian Health, and that's serious. So Kevin, you're essentially a key player in that whole process. Tell us what's in the building, what's going to be there.
Right, so the first 3 floors are going to be our health and wellness center, which for us, getting back to our roots of healthcare, originally our corporate offices were always located within our healthcare offices, and this is a way for us to kind of get back to that root core to kind of who we are, running healthcare. And so the first 3 floors will have imaging, ambulatory, a retail pharmacy as well, and a whole slew of other
doctor's offices.
Doctor's offices, yeah.
Surgery center, right?
There's no surgery. There's surgical specialties will be in the building,
right.
So they will be able to see patients there as well. There's around 100 exam rooms total in the whole building. So over 40 doctors and over 100 healthcare professionals will be located in the first 3 floors, working weekends and really opening up those services to the community. Within the rest of the building, there are 4 floors where we are relocating our current 3 separate corporate offices into one single location, again, bringing everyone back together under one roof. And we're really excited about it. We're really excited about being in Woodbridge and moving locations down the street to a train station where we can have our team members get there much more easily, and while patients in Woodbridge will benefit from our services being there, patients from all over will be able to use our services as well through the train station.
It's amazing how aligned the things that are important to the hospital are with the things that are important to the municipality.
Right.
The distance from New York and Philadelphia, very key for both of us. The opportunity to be among a place where there's so many great support services, restaurants, hotels, all the things that you need to run a world-class headquarters office, and all the things that you need to service a set of patients that has diverse requirements and needs. We have JFK not very far from this site, full care, acute care facility hospital, and it's just not enough. The growth in that business and the growth in the needs is going to continue for the foreseeable future. And being at a train station where people can make their healthcare decisions differently than they have, it just goes to show nobody could have figured Hackensack was going to end up taking the site when the Murphy administration made it available. But when you put something out there, you get a lot of good ideas.
And this is the first of its kind ambulatory center at a transit facility in the country.
Yeah, it's the first health and wellness center at a major transit hub in the nation, which we're really proud of and excited about, and hoping that a lot of other folks, and including our own team members, can kind of emulate that for the future. It's all about accessibility.
And you mentioned JFK Hospital in Edison, which is right outside our border. On the other side of the border, Raritan Bay and Perth Amboy is right there. So you've got a presence in Woodbridge already.
It's a very vast hospital healthcare network. Probably the largest property user in the state, and certainly the most active right now. You've got another first, though. I think it's also the first healthcare headquarters at a train station, too.
I believe so. Yeah, one of, if not the, yes.
Yeah.
Now, both of you were at the State of the Township last week, where I thought the biggest announcement was going to be, and I spent about 2.5 pages on Hackensack Meridian Health, talking about everything. 250,000 square feet of office space with the big medical center in it, right Metro Park, and you got upstaged by a grocery store.
Such a good grocery store, though.
So, folks, you probably know if you're anything on social media or YouTube or all that kind of stuff. Trader Joe's is coming to Woodbridge, right across Route 1 from Woodbridge Center. It's, I say, the Bed Bath & Beyond site, but when people say that, they think of the site on further down Route 1 South on the Parkway, but it's not that. They moved and then they closed. So it's right next to Raymore and Flanagan in the Best Buy retail mall, and that's just upstage. A 250,000 square feet or a 50,000 square foot, grocery store. You got beat, man.
I thought Carolyn was going to jump the stage. It was at the back of the presentation, and she was right.
She's jumping up.
Well, you know what? We're going to do our best to do you proud here. We'll try to compete with the Trader Joe's.
All right,
we
sounds
can
good.
But for economic impact,
but part
we'll
of-
have 1,000 jobs at our place, right?
Yes. Yeah.
Wow.
Definitely a lot of jobs moving into the area that currently aren't there.
No butchers, but
No.
You never know. You are going to have a residential piece and mixed use, some restaurants, and maybe some retail that the people going on the train or the people who live there or the people that work there can use. I always, Metro Park needed an uplift, and we all know that. And your being there as part of the project, you're going to make it look better, feel better, and being the second largest station in the state next to Newark, it's something we should be proud of, and you're bringing the pride to it. So it's
an
a win-win
activation.
everywhere.
I think it was long in the waiting.
Yeah.
So in the residential building, we also took office space in the residential building. You want to talk about that?
Yeah, so we're working through some programming there as well. With such a big building, you'd be surprised we ran out of space, right? and there's always more needs for healthcare. And so we're kind of working through that programming at the moment and seeing what that perfect fit is to kind of work with the hospitals that are nearby and our current location at our Metro Park building to make sure they marry and mix in a nice way that really the community is going to be served and meet most of their needs to really finish that one-stop shop model that we were looking to make in the Metro Park building.
And one of the things we like the best about this, and I'll let Carol take over, is the Aspire grant, which requires you to spend money in the community you're moving into as part of getting the tax credit financing from the EDA. Take that away, Kara.
Yeah, so it is, I think it is like the biggest bonus that we have coming from this project, and it's astounding. From the Aspire grant, so you are getting tax credits, but as one of the things that you need to do to get these tax credits is provide a community benefit. And being that you're a health center, it's a health community benefit.
Right.
And you want to give the numbers?
Yeah, so I mean, we could jump right in. We've committed to giving about $350,000 annually over the next 10 years to multiple.
For those watching at home, that's $3.5 million.
Yes. Over the next 10 years, and we're really excited about it. It'll give us an opportunity to bring our services into the community outside of just our building alone, and really meet the needs of what the folks living here, kind of have.
Which you'll first get by doing that community needs assessment.
Yeah.
Which,
No, go ahead.
I jumped on it. I'm sorry. Go ahead.
No, it's really great.
We'll first find out what we need.
Right.
And you'll talk to all the people in town, in the healthcare field and in the town government and the school system, and you'll find out what we need and then go from there.
Yeah, absolutely. And we've done community needs assessments in the past, but more county-based, right? Not as localized. And so this one is specific to just Woodbridge. And we'll be able to focus on kind of all the key points that the specific people here really have, right? And their concerns, we'll be able to address them, figure them out, and then create a plan to go meet those needs and really give healthcare to the people.
So we did one of the projects that we worked on, and I've shared this with you, is for Sustainable Jersey. We did an assessment so that we could become a health gold town, and I think, as usual, we were probably the first town with gold in health. But we did that assessment, and we learned so much. And one of the things that we learned was that we had areas of the town where more people were going to the emergency rooms than in New Brunswick or Perth Amboy. And when somebody's going to an emergency room, it means they don't have a doctor.
Right.
And you need to fix that. And so it taught us a lot. So that's just one thing. One thing you can learn from an assessment. So, and out of that, we got the Health Mobile. And that's part of what our partnership is going to be going forward. Do you want to talk about that a little bit?
Yeah, absolutely. I mean, one of the things that we worked on is figuring out what the supplies are in that mobile health unit, and then kind of working over that 10-year span to make sure that it's fully equipped with all the supplies and equipment that you would need. So we've dedicated a certain amount of money yearly to just that alone. And again, it's to support a lot of the amazing things that you're already doing.
And you guys had a mobile health unit that we used to bring every now and then to like the apartment complexes in the neighborhoods in the underserved areas. It was Raritan Bay or JFK, as Hackensack, even before you were Hackensack probably. But those hospitals were big partners in that, and they would bring the mobile health unit, and the moms would bring the kids, or dads would bring the kids. And like you say, many times it was the first time they even saw a healthcare professional if they're 4 or 5 years old.
You have to sometimes take the services to the people. And that is one of the services that you are offering.
Absolutely.
Because you are talking about going to areas where people can't go to a doctor.
Right, and like you said, the emergency room thing, right? We're finding those needs, and we're looking to go address them directly in the community so that folks don't have to go to the emergency room. We can act as their doctor in those instances, and also we're adding a lot of doctors in the region to begin with too, which is, I'm sure, is a big help.
Right.
And that's the nice thing about the program is over the 10 years you can adjust it.
Right.
So if year one there's a priority, year two it's a different priority, because the amount of money is fixed and because the provider has their business realm that they already are in, you have the benefit of being able to indicate where you want that to go. Which is, I think, really one of the nice parts of the Aspire Grant program, honestly, is that it assures that the community gets not just the economic activity, but the civic and cultural activity that also should be a part of, such a broad vision type of program. There's not very many people who could take advantage of it the way that Woodbridge can.
Right.
Thank you.
Because you need the scale, you know what I mean? You need the community, you have a health department of your own that's,
Excellent.
award-winning. So, you've got a lot of advantages that make everything work better.
Talk about that, Kara, because we have a whole group of nurses and a whole health department and an environmental division and a whole lot of different things. and we went out to talk to them, talk about how Hackensack's professionals are going to kind of complement what we do, not replace them, but complement.
Right, and we talked this while we were waiting to start the show. We talked about how you go in and actually meet with the health department and find out what it is that they're looking for from you, because they're the ones who are going to work with you to provide these services. But it was really interesting when the mayor and I first went out to meet with them, and they were all nervous that you were coming in and taking their jobs. And we told them, no, you're going to be partners. They could not have been more excited about this going forward. It's just going to be a benefit for everybody. And wait till you meet the people who work there. They're phenomenal. We have a great, and aside from the Department of Health, we have a health task force, which is made up from some of the people from the Department of Health, some of our residents, some of our local doctors, and they also help us with making our goals and what we're going to do. So there's a lot of interest, and we have a councilman who runs the Mayor's Wellness Committee. And we just have so many people focused in on health. And of course, we always get the Healthy Community Award. Yes.
We learned a lot just from that meeting with the nurses. I was amazed at how unbelievably smart and dedicated they were. I see them, but not ever in an environment where you sit down and really talk to them. See them at the Health Mobile, see them at the health fair, see them they take a table along with the library and all the different groups and all the different things we do all over town. You see them and you meet them, but we sat down and talked about what they do, and it was amazing.
They are great. They're
a lot of hard work.
Yeah, and I think I sensed, which is why we went out to meet with them, I sensed that as word was getting out about this grant, that they're saying, okay, wait, they're getting nurses. Well, we're nurses, and we're employed here, and we have a nice job and benefits, and what are they doing, bringing in new nurses to replace us? So we said, let's get the heck out there and let them know that you're fine, and we love everything you do.
Right.
This is going to supplement. You know what's going to help us maybe get to the homebound? It's going to maybe help us with the schools. Supplement the school nurses. There's all kinds of things we can do.
And all the outreach that you're going to. I think your outreach, your digital stuff, is a whole step higher than what we've been able to do, and I'm looking forward to that.
Right. I mean, we always feel that that's a very important part, right? Is you can have the resources, right, but everyone needs to know about them, and so we're really dedicated to, from digital to any kind of area, finding what we can do to make sure that the people of this town know the services that we're bringing and where they can find them.
And the grant's not the end of the collaboration and the connection point between the municipality and the hospital. Like in other towns, we have programs in most of the places where we have even mid-sized offices, there's some kind of community engagement. And that I think would happen again here. And you've got, that's going to be, healthcare is one of these things. By being the latest one in, what the services that are going to be offered in the ambulatory center are going to be top notch. Like the technology and the protocols are all going to be the very top of the industry. So it's a really great asset.
And you're going to have all of the equipment. We've all been watching it being constructed, and how thick are the floors? That amount of cement, 18-inch. Imagine that. It's that's solid.
And how fast is that building going?
Every time you drive by it, there's another floor there.
I know.
And I understand your president goes there every morning to check it out.
Yeah, a lot of people are really excited, especially now when it's pretty high up, right? They're moving it, so people go there every day. Yeah, we're excited about it.
All of a sudden, that site looks a little smaller now. You know what I mean? For years and years, you had acres of empty parking and flat surface, which doesn't really make any sense for a train station to have that. But there's a big building going up there.
And what I really like is I don't get the feeling that we're ever going to say, hey, can you cover this? And anybody from Hackensack's going to say, no, it's not in the grant. I don't feel like we can ask anything. I feel we're going to have the kind of relationship where, sure, it's not in this grant. We'll do that. We'll work this out. And if you need this, we'll get it done. Yeah. And I feel comfortable about that.
The grant's only a small portion of our relationship with this town, right? And it's a small portion of what we want to be involved in the community. So while we're really excited about the grant, we're really excited about all the other things that we're going to do as well in relationship with you.
And like I think Carol said, the outreach you have in communications is going to really complement. We're good at that,
Right.
but it's your field, so you're better, and you can reach people we can't, and you know who they are in many cases through Kennedy and Raritan Bay. So I think that's going to be invaluable to us, is getting the word out through you that for people we can't reach.
And the services that we offer can be improved because we'll learn from you. For instance, as great as our health mobile is, I mean, a couple of weeks ago it was on Main Street and there were literally people in line waiting to go in. It's just popular, but you know, they try to do tracking on there and they have a computer system, and I can't wait till you guys get your eyes on it because I know that's something that we can be doing better. I mean, they did a great job of working it out, but we need to, you know, how many times have you been here before? What did you get the last time you came? Because we now have some seniors who are regulars. Every time we go to a certain senior center, it's the same
Some
one. It's
people get
checking their blood pressure.
checked every time they go to the senior center when the health unit is there.
Right, they look forward to it.
Yep.
And they have a calendar where they're going to be where, and people go. They're at supermarkets.
Right.
They're everywhere, and they'll probably go to Metro Park.
Hopefully.
So,
And I get the impression that you're going to be involved in the community outside of just the healthcare effort. You know, you'll be on the Chamber of Commerce, you'll be on the Woodbridge Economic Development Corporation, you'll be out there. Like Linda Mazzella, who's been with Raritan Bay and JFK for a long time, was always that person representing those hospitals and was very active. And I feel like you're going to continue that with your representatives and be a part of the fabric of the Woodbridge corporate community.
No, look at if you think about it,
Right.
the Onyx people are here, the Russo people are here, the Denalo people are the most generous among all of us and want to be involved in the communities that they're in. Their offices in the Meadowlands quite close to mine, and they're always involved in stuff. Then you've already got some of the healthcare institutions from Hackensack Meridian are already contributing and volunteering and participating in civic things in the town. Now there's a whole nother layer of executives who come, another layer of doctors who come that are here, and obviously a lot of these people are going to end up living in Woodbridge. Because if you think well, first of all, you have 200 apartments right next door. So those people live in Woodbridge, and they would be expected to consume their health care, nearby. But there's going to be a lot of people who are currently commuting from other places who will look at this and say,
Hey.
this is the town I want to live in. And it's really a great dynamic. So I think there are a lot of layers of people. JLL has done stuff here. We participated in a panel on your economic development forum last year. And
That
we
was
learned
great.
the market here in a different way than we knew it before. It's a worldwide company with lots of resources, but there's nothing like working closely with people who run a town to figure out what it is that you can do to help. And that doesn't happen from afar, simply putting a sign up on the side of a building and saying, for rent. It happens when you're thinking through how the town works better as a result of what these guys are doing, which was a really terrific process, I think. I really enjoyed it. It didn't feel like there was any friction in it, and that's unusual sometimes.
right.
Yeah, it went smooth.
The development process was fantastic. I hope you guys feel the same way.
We
but,
definitely feel the same way, yes.
Yeah, it
Well, you've got
was.
the
been
right
amazing.
people. Denalo
Right.
and Russo and Onyx are the best around.
Right.
They won the competition. It was very spirited, very intense, and they won it. And they won it because they're so good.
And your construction company, that's Terminal?
That's Terminal.
Terminal.
That's Denalo. The Denalo
Oh, that's
family.
saying,
Yeah.
unbelievable.
It's
When we drive by there on a Saturday, they're working.
Yeah, no, it's
Yeah.
not. It's not normal.
Yeah,
You're talking about a month into construction. You're usually talking about the delays.
right.
A month into this construction, we had already cut 5 months off of the construction schedule. So you had a 14-month construction schedule that got cut.
Right.
Or, I'm sorry, a 19-month construction schedule that got cut to 14 months.
I'll bet a
was
lot
so
of that had to
fast.
do with the pressure that HMH was putting on them.
we didn't really need to get much. They just they thrive whenever
They
they're
wanna get
operating.
done.
And
They
and
definitely wanna
it's-
finish.
It's their MO, so it
Sure,
was
they
easy.
could start something else and make more money. So we talked. If you heard it in my speech, I talked about how the money from this project, the tax money, is going to go for a brand new school, and I talked about how the kids in Hope Lawn and Caseby, which is kind of the area you're going to be looking at anyway, to try to get services there. But now those kids will have a school in their neighborhood. That's being done with Hackensack Meridian Health's money. That's a nice,
Well, we like hearing you say that, but really it's your money. We're the guests in the town. We're paying the tax because we want to be in the town.
No, I know.
And you've provided the.
But it's a
you got to
big,
take a little more credit.
it's
for
a
that.
big project. It's a $78 million project on one end, and then you're providing $97 million in taxes over 30 years on the other end. So it's a perfect marriage that we identify 78 plus interest on the debt equals the 97 that you're going to provide. It's got to be good for the company to know that you're literally not just giving money to the town in taxes, they're using it for a school for kids that they don't have. They drive a half an hour plus on a bus each way every day.
It does feel a lot better than filling in some gap because the municipality is poorly managed. For sure. But you got back to your Aspire grant. I mean, doesn't the Aspire grant solve a lot of problems, right? Because we could not have done this economically. It didn't make sense to do this as a new construction project without the state saying, you know what, that's transformative, and we got a transformative grant. And this is the definition of a transformative project.
Absolutely.
And so, to bring that here, and then be able to have the resources to do the community benefits, to do, a legitimate pilot and make sure the town is rewarded by that or supported by that. The fact that the Aspire grant is there to do that, it was $114 million. It's a lot of money.
A lot of money.
So we got about 2 minutes left. Carrie, you want to wrap up anything before we close?
It's one of the best things that has happened to the Township of Woodbridge is to have the hospital and to have all the services that you're bringing to us, and we'll help you all along the way in the development. And once you're all built up, we're there to continue to be your partner.
And we'll do all we can to drive people to there.
Yes.
Some of the services you're going to pay for, we can work with you to provide them there, so our people will be forced to get there and learn the place and see what doctors are there. Any final closing words from the two of you about the whole project? We got 1 minute to
It's
go.
got to be you about the
Yeah,
healthcare
so,
system.
I mean, we're really excited to work with you, the mayor, and the town here, obviously, and we really feel like we're bringing the services that are not only needed, but not always provided in a lot of the areas, and so we're really going to have a whole one-stop shop here at our new HMH at Metro Park location, where everyone can get most of their needs, and if they're not getting their needs there, we'll be able to refer them to a very close place where they can get their needs there. So we're really, it's a full picture that we're trying to provide here, and we're excited about it.
Well, thanks. We can't wait. We love working with you guys. You're easy to talk to. You're easy to deal with. You're easy to negotiate with. This is going to be great, as Carol said. One of the best things to ever happen in Woodbridge Township is Hackensack Meridian Health opening up their New Jersey corporate headquarters right here in the Metro Park train station in the Island section of Woodbridge Township. So this has been Around the Best Town. John McCormick, Carolyn Ehrlich, joined by Ron Simoncini and Kevin Martinez. Ron from Jones Lang LaSalle, Kevin from Hackensack Meridian Health. Thank you for watching, folks.